Hi, hello everyone. Welcome to discussion of RGUHS MBBS question paper pattern, that is of anatomy as per CBME curriculum. In this session, I am discussing about distribution of topics in your anatomy paper 1 and paper 2. What are the versions of question paper pattern that is given by RGUHS? And the pattern, number of questions, number of long essay, number of short essay, and also number of MCQs. And lastly, few points about practical examination pattern. Yes, let's start with the distribution of topics. As you know, RGUHS exam, there are two papers, anatomy paper 1, anatomy paper 2. Anatomy paper 1, distribution of topics like this. General anatomy, 6 marks. 6 marks. Like example, the question can be asked about types of joints. Classify cartilaginous joint. Classify fibrous joint with example. Classify synovial joint. So, one example for question from general anatomy, usually 3 marks question. General histology, 5 mark. Like example, types of epithelium. General embryology. So, the question can be asked about fertilization, gastrulation, blastula, graphene follicle. So, about the general embryology. Then comes is your very important topic, upper limb. So, 18 marks. Like median now can be a short essay, and also there can be a question like clinical type of question. Like example, last year exam, Saturday night palsy. Saturday night palsy or foot drop, wrist drop, radial nerve palsy can be asked, or post intrusions now, anterior intrusions now. So, very commonly asked in our exam. Then thorax including diaphragm. So, that is around 21 marks. So, in diaphragm basically nerve supply of diaphragm, that is phrenic nerve, openings of diaphragm very commonly asked, like vena cava opening, esophageal opening, aortic opening, very commonly asked. Heart, one very important topic from thorax. Then comes his head and neck, so which is the one most difficult one, that is around 29 marks. Neuroanatomy, one more difficult topic in paper 1, 13 marks. So, this is about anatomy theory paper 1. So, there are 2 long essay, so 10 mark question. There are 8 short essay, 5 marks question. There are 10 short answers, around 30 marks, and 10 MCQ as per recent RGUHS guidelines. So, this is about the anatomy paper 1. Paper 2, if you ask me, systemic histology, 11 mark. So, one very commonly asked is compare and contrast between prostate and vas deferens, epididymis, liver histology, renal histology, bladder histology, ureter histology, duodenum, jejunum, ileum. So, anything that can be asked from the systemic histology. Systemic embryology, the one very commonly asked question is mesonephric duct, paramesonephric duct, derivatives, hindgut, midgut, foregut. Then genetics, around 8 marks. So, some commonly asked questions are Klinefelter syndrome, Down syndrome, Turner syndrome, chromosomal anomalies. Lower limb, around 18 marks. So, lower limb, I think last year exam the main question, arches of foot. Okay, so very commonly asked question, hip joint, knee joint, or it can be ankle joint. Abdomen, 31. So, one difficult topic to read, like example lesser sac, greater sac, epiploic foramina, stomach, difference between jejunum and ileum, anal canal can be a main question, rectum can be a main question. So then gallbladder, liver. So pelvis around 21. I think pelvis is scoring. Why? Because pelvis, very short chapter, 21 mark, especially uterus, fallopian tube, parts of the uterus, parts of the fallopian tube, that can be asked. So this is about the anatomy paper 2. Again, 2 long essay, 8 short essays, and 10 short answers, 10 MCQs. If you ask me the version, so there is a version that is given by RGUHS. So version 1, and there are 2 versions given by RGUHS. So in version 1, the long essay should come from upper limb or from the head and neck. Okay. So in the same way, short essays, upper limb, question number 3, 3 questions like 4, 5, 6 from thorax, 7, 8 from the head and neck area, neuroanatomy, that is around 9 and 10 question, and 11 and 12 basically from general embryology and general histology. Short answers, upper limb 1 question, thorax 2 questions, head and neck 3 questions, neuroanatomy 1, and short answer general anatomy, there are 2 questions. So like this, it is in version 1 of the paper 1. If you ask me version 2 of the paper 1, so either 1 question from thorax, usually mediastinum or heart, blood supply and all, and head and neck area. Okay. So then again, short essays, 3 from the upper limb and 1 from the thorax, so 2 from the head and neck, 9, 10 from neuroanatomy, and 11, 12 that is the general embryology and histology. So this is almost same only. Again, there is no rigid rule actually, but this is what the version 1 and version 2 you should understand. Fine. So this is the recent paper of your exam, December 2024, that is the supply exam. So you can see here 1 question from the thorax, and the second question is about head and neck area, that is the tongue. Okay, right lung and the tongue is the question asked. Okay, so what are the attachments, actions of muscles, intrinsic, extrinsic muscle, nerve supply, anti-2/3 and posterior 1/3, and a lymphatic drainage is the question asked with a neat label diagram. So and paper 2 again, version 1 and version 2. In version 1, main question can come from lower limb and 1 question from abdomen. In version 2, you can see here lower limb and pelvis. So this is about the version 1 and version 2 of the anatomy paper 2. Again, anatomy paper 2 you can see here. So there are 2 questions. One question, question number 1, you can see about the thickest nerve, probably it is sciatic nerve. So sciatic nerve is the main question and the repeat question, and also parts, visceral, peritoneal relations and supports of uterus. So that is a question number 2. So it's actually pattern number 2. It is version number 2 that is asked in your supply paper December 2024. Okay. Okay. Then there are 10 MCQ I discussed. So all these are the MCQs asked in our RGUHS exam. So question number 21. So that is basically 5 MCQs. So Roman letter 1, 2, 3, 4, and 5 you can see here. So question number 21 usually consists of 5 MCQs, and 22 also same. So there are 5 MCQs are there. So all of you please remember, so to get good mark or to get distinction in your exam, you should write more about applied anatomy. Like example, radial nerve is asked, you need to write about the radial nerve applied anatomy, like example wrist drop. Median nerve asked, you can write about so applied anatomy like carpal tunnel syndrome. Okay, then comes is your practical exam. So practical exam. So practical exam. So it's again 100 mark practical exam. So as you know, you should get 150 out of 300. So 150 out of 300 to clear the exam. Okay. So either it can be 40, 60 or it is 60, 40, whatever it is. It should be 150 out of 300. The passing percentage is 50%. So you should get at least 150 in your 300 total marks. Okay. So practical exam, if you see, again divided into general anatomy, general histology basically, and the viva-voce. So general anatomy, as per RGUHS guideline, spotters 20 mark. So there are 10 spotters. Okay. Window discussion, that is above the diaphragm 1, and below the diaphragm, that is about 2. So 15, 15, so it is around 50. So gross anatomy, very important in your practical exam, is around 50 marks. Then comes his histology, spotters 10 mark, slide discussion 10 mark, usually from general histology. Slide discussion 2, that is from 10 mark, around it is from the systemic histology. So histology and gross anatomy, very important, 50 plus 30, that is 80. Then comes his viva-voce, basically osteology 5 mark, surface marking 5 mark, radiological anatomy 5 mark, embryology, that's around 5 mark. So total it is 20. So total it is 100. So theory paper 200, practical examination is 100. So it becomes 300. So passing percentage is 50%, 150 out of 300. So either you should get minimum 40% in the both the papers and 60% in your practical examination. Then there are some few points given by RGUHS. All the question paper follow suggested blueprint. So we already discussed about the blueprint. So question paper must follow this blueprint. The marks allotted to particular topic are to be strictly adhered. Strictly adhered. Minimum 35% of marks shall be allocated to assess higher order thinking skills of the student. Higher order skills. Okay, like example, so recently asked in a theory paper, a clinical scenario of stomach carcinoma, then they're asking the question. Clinical scenario of tongue cancer, they're asking question. Clinical scenario of wrist drop, and they're asking question like this. All the different types of structures given in the blueprint, arteries, veins, nerves, are to be compulsorily covered in each question paper. Systemic histology, systemic embryology, not to be covered in paper 1. So this is clearly given by RGUHS. Systemic histology and systemic embryology must be in your paper 2. So and also I discussed about the version, 2 possible layouts. So we discussed already. So core competences should be assessed in university exam. Okay. So one short question, one short essay, basically 5 marks question. So one short essay, 5 marks question, or one short answer around 3 marks question, to be modified variety contain a clinical case scenario. So it's clearly given. So one short answer and one short essay should be in the clinical scenario. So requiring an explanation of the concept or drawing diagram. So okay, or it is given drawing diagram. So usually in RGUHS 3 marks question, basically draw label diagram of fallopian tube and the parts, draw neat label diagram of gallbladder, and so like that the question can be framed in your exam. Okay. So the question related to general systemic histology. So general and systemic histology must be of higher level than simply drawing and describing histology slide, as this will anyway to be covered in practical component. So all a few points about preparations of question papers. Okay. So this is about the anatomy. So we discussed about distribution of topics in your RGUHS. We discussed about a version of question paper and what is the passing percentage, and also some few points about preparation of question papers as well. So for physiology and biochemistry, you can watch our other videos as well. I wish you all the best. Thank you.